Now the calls continue to increase on the doctors to return to work, and whether there's going to be a deal that will be struck between the government and the doctors so that they can head back to work. That is a conversation that we're going to be having this morning. And I'm joined by Pius Nyakundi, who is the CEO, Kenya National Union of Medical Laboratory Officers, part of the unions that are currently have downed their tools. And we're going to be having that discussion this morning. Pius, good morning. Thank you so much for sparing time for us.
Welcome, welcome.
Let us get into it. You joined other unions about a week ago to join the ongoing doctor strike. Are your demands similar to the other unions?
There are those that are cutting across, and there are those that are very specific to the laboratory professionals. Yeah.
So, for example, for your own, what are some of the demands that you're having?
Our demand, number one, Grace, is that the Kenya National Union of Medical Laboratory Officers is a legally registered trade union in accordance to the Labor Relations Act of 2007. The union was registered in 2018. And we requested the government to sign a recognition agreement with us. That is 2021. To date, the same has not been done, despite the fact that last year, July 13th and December 5th, 2023, we did a reminder to the Minister of Health to consider signing this recognition agreement because it's not a privilege, Grace. It's a right that is already enshrined in Article 54(1) of the Labor Relations Act. So to date, now that there is no communication from the ministry, even despite the fact that we issued a strike notice on 26th, to date, they have never responded. We have never been called to the table to discuss about it. So one of the issues that is very specific to the medical laboratory professionals is that we have a legally registered trade union and we need a recognition agreement. That one is very specific to the medical laboratory professionals.
So what you're trying to say is that you feel left out by the ministry?
Yeah, the ministry have ignored us, and we are a very key pillar in the medical world, because we are the people who do diagnosis. Now the ministry trying to ignore us, even, this recognition agreement does not need any budget. It's just a pen and a paper.
All right, so apart from being recognized, what else are you really out there for?
We are out there for, Grace, our medical laboratory professionals who are on job group K, and those that have been redesignated to medical laboratory officers. They have their risk allowance, they all lose their risk allowance. And what we are even being paid is 3,000 shillings. And these are the people that each and every day, they encounter a lot of risks in their pensions.
The 3,000 is for the risk allowances?
Risk allowance, that's what we are being paid as medical laboratory professionals.
Okay.
And now when these people have been promoted to job group K, or redesignated, they all lose this allowance. Yeah.
So what are you asking for out of the 3,000?
We are telling the government, we are not even, as much as we feel that the 3,000 is very little, it cannot even be able to compensate on the risk that we go through each and every day. We are telling the government that this is money that was in our pay slip. We are not asking for something that was not there. Return this risk allowance. They deserve it. Yeah.
All right, and we also, when you talk about recognition, you also want lab professionals within the healthcare system to be recognized. What is the current status? When you say that you're not being recognized, what is the current status?
Grace, when you have a legally registered trade union, for you to be able to bargain on behalf of your members, you need a recognition agreement.
Yeah.
That is an agreement that is signed between an employer and the union. For example, if you've had our colleagues from the other side, that is the doctors' union and the clinical officers' union and the nurses' union, they're talking about a CBA, a collective bargaining agreement. But in this case, as the laboratory professionals, under the umbrella of the Kenya Medical Laboratory Union, we cannot be able to engage the government in signing any CBA because we don't have a recognition agreement. So it's just like a foundation of engagement. Yeah.
Perhaps if you can take us through it, because now I feel like it's a bit interesting. The union was formulated in 2018.
Yeah.
And since then, it hasn't been recognized.
It hasn't been recognized.
So what steps are you supposed to take for you to be recognized?
The steps are very simple. You request through the ministry. And then the ministry now, because you request and you attach the draft, the ministry goes through it. And if maybe there are some amendments they feel that they deem necessary, they can be able to tell us. The ministry has a team of legal experts who are supposed to go through the document. But to date, I doubt if they have ever seen that document. Maybe it's in their archives.
Wow. And perhaps what more have you done? Have you tried going to their offices to demand for it?
We've done so. What we did in 2021, we requested formally. Last year, as I've said, July 13th, after meeting ministry officials, they told us to give them another copy because they could not be able to trace the one that we had already served them. So we did the same document on July 13th. I have a letter that has been stamped as received in the ministry. We did another letter on 5th of December. And when we felt that the ministry is not really responding, we did another letter requesting to meet the ministry officials and have a consultative meeting to discuss over the same issue. To date, nothing has been done. And as we are speaking, if we issued a strike notice on 26th, and our strike tomorrow, it marks the second week, nobody has responded to us over the same. Forget about some issues that have some monetary implications or budget. These are something that needs goodwill, a pen and a paper, and as I've already said, it is a provision of the Constitution and the Labor Relations Act. It is not a right, it's not a privilege. Yeah.
Now, to avert the ongoing strike, there is supposed to be a joint parliamentary committee meeting tomorrow.
Yeah.
Have you been invited now that you feel like you're left out as compared to other unions?
Yeah, we have received the invitation. Yeah.
All right. So you're hoping that
we are hoping for truce between the parties, but you see now the first thing that we should look at is that the employer must be ready, because even if we discuss these things with the assembly, we have had a lot of issues that the assembly has given consideration. For example, the employment of universal healthcare coverage staffs who have been on contract. The Senate gave a recommendation, a report, that these staffs should be given permanent and pensionable terms. But the ministry has not done the same. It has laxity and is trying to play some games which are not right. So the Assembly and the Senate can do their role, but you see the employer is the one who has a mandate to do the same.
So in your words, do you feel like having a meeting with Parliament is not the solution?
No, I've not said that entirely is not a solution, because in Parliament, we have members of Parliament who are representing their constituencies, in whose facilities are experiencing this industrial action. So maybe we'll be looking at how the Assembly, the both houses will be able to look at our issues and give recommendations to the people concerned. And in this case, these are the 47 county governments and the Ministry of Health. Yeah.
All right, so the ongoing engagements between the government and the doctors, it feels like they're hitting a snag, right? It's not really we're not really having a solution. What do you think the problem is? That is one. Two, we saw the IG, Inspector General of Police, Japhet Kome, threatening the doctors to go back to work, claiming that, the picketing that the demonstrations that they're currently having is illegal. Do you think that's the right route to go to?
First, so I've already said I'm a Secretary General of Kenya National Union of Medical Laboratory Officers. I might not be able to know the status of the negotiations with the doctors' union, but because they are our colleagues, I feel they are hitting a snag because the employer. The last time I saw the employer walking out of a discussion, and there's a time that I saw the ministry sent a party of lawyers to discuss with the doctors' union. You see, lawyers were supposed to meet them in court, no discussions. Yeah, and about the inspector of police, I can say, Grace, it's very unfortunate that in a country where we have laws and the Constitution, the Inspector General of Police cannot purport to suspend Article 37 and 41 of the Constitution. We have been here before. We've had peaceful demonstrations from all trade unions. At no given time, we saw the public nuisance that the Inspector General is trying to regard the industrial or the picketing. So I can say maybe the Inspector General of Police is not sincere, and maybe he has not been observing how these demonstrations have been going on, because the only violence that I saw is when the government meted violence to the Secretary General of KMBDU. It is the government actually that makes violence on its citizens. We've not had a situation whereby we are throwing stones or we are shouting. And I think the Inspector General of Police needs to get serious, because that is a very senior position that he holds. He should not be addressing us as thugs. And before him, we have had several Inspector General of Police. We had Boynet, we had Kimayo, we have very many. So he's trying to misuse his powers, and what we are telling him today is that we will not be cowed. We'll go to the roads. We have been given the rights by the Constitution. They are not donated to us. Yeah.
All right. So your men and women, as I said earlier, also joined other unions in the ongoing doctor strike. Perhaps how many are registered under your union, and how many are they all? Have they all down their tools?
First, the union is representing over 20,000 registered medical laboratory professionals. About membership, we have around 7,000 active membership. And about downing tools, as I said, we started a strike on 2nd, but we had not involved the key emergency areas that the laboratory provide. For example, the National Blood Transfusion Services. We had the KEMRI, where we do the research, and the reference labs. But as I'm speaking today, we had a meeting on Friday, and we decided that today we are escalating the strike further, and we'll shut down all those services. Because we are very key people. Today, if you don't get a laboratory personnel in a laboratory, for example, in KNH, and you're supposed to go for dialysis, you cannot be able to proceed. If you need blood, for example, you have a patient who is going for CS, or there's an accident and trauma and they need blood transfusion. These are the people that do that procedures. So as we are speaking today, because the government has decided not to listen to us, we are shutting down all the services. Yeah.
Right. Biggest question now is at the expense of an innocent Kenyans, because now when you down your tools, the person who's suffering the most is a Kenyan. So at what length what would it really take for you to think like, you know what, Kenyans are suffering more out of our decision to strike?
Grace, it's unfortunate that the strike has always been the last resort when it comes to these industrial disputes. You see, if we engaged an employer in 2021 of a recognition agreement that needs a pen and a paper, does it need any budget? Those are how many years? 3 good years. We issued a strike notice. To date, as I'm speaking here, we have not been given any audience. So in short, the government has gone on strike. And they are not serious anyway. Because as they are talking about budget, they cannot be able to meet this because of this and all that. Have they tried to look at what we are really demanding? A recognition agreement, for example, because if the government could be able to meet some of these issues, we can sit down in a table and say, okay, fine. As you have granted us this one, let's proceed to have some other discussions and have a return to work formula. So
basically, before we wrap, what you want is just a commitment from the government?
I'm not saying a commitment because, okay, fine, a commitment must be there. Second, we raised, in our strike notice, we raised around 9 issues. There are those that need budgetary implications. There are those that need goodwill like this one. So what we are saying, the government should come to the table to tell us that, okay, fine, we cannot sign this recognition agreement because we feel that we are inferior or we are not ready or we have gone on strike as a government. Second, if we are talking about a risk allowance that was there in the pay slips of our colleagues, we are talking about Grace. There is another unfortunate thing that I've not told you here, that we've had guys working on a contract for the last 15 years. And these guys, their contract ended last year, the Global Fund. To date, they are on duty. There is no communication. They don't get salary. And these are parents. These are guardians.